The staff here amazes me day in and day out with how much empathy and support that they deliver to families and patients during difficult times.
I think one key is really education of the staff about what this can mean for the families. We're all aware, we also take care of many organ recipients, and we're of course aware of how life-changing that can be for the patients and the families who are receiving that life-saving gift.
There's more awareness of donation than there was even 20 years ago, let alone 30 years ago or 40. And I think that that's the important piece, is getting that awareness out there for how important organ donation is.
I think the first would be the fact that we want to be able to, offer to the families the ability for something good to potentially come from something that was so terrible. So specifically as a trauma surgeon, we see so many patients that have suffered such devastating injuries, and unfortunately in young patients. And it takes all of the team to be able to speak to that family in a caring way, and to be able to, offer them the ability to give the gift of life.
I've been a nurse for 32 years. I think for me personally and for the staff, it's just trying to meet sometimes that final request of a family who is put in a dire situation, and being able to meet that need and actually giving the gift of life is really what is the most rewarding part of all of this.
As a trauma surgeon, from the emergency room to the SICU, everybody is very committed, and it takes all of us to have that commitment to assist the families in dealing with these very difficult situations, whether it's the nursing staff talking to the family, whether it's the surgical residents, doing their best for the patient, the trauma surgeons or the cardiologist doing the echo, or the pulmonologist doing the bronch, the radiologist doing other studies. I mean, it really takes everyone at Temple at every level to really be there for the patient's family.
One of the most difficult things in end-of-life care, and one of the things that I really strive for when I'm involved in that process, is to allow all parties to walk away with the sentiment that the right thing occurred, and to allow them to move forward in the most positive way.
Originally I went into nursing for the altruistic reasons, save everybody, save all the lives that I can, and to give all that I could to the community. As I became more seasoned, I learned that saving the lives, while very important, is just as important as helping the families deal with the loss of life. And both of them are equally as important to me now. The bottom line is, you need continuity of care, and you need to have nurses that know their patients and patients that know their nurses.
I see all sides of our successes in the ICU, and then also the cases where we unfortunately are unable to save a life. But part of the reason I do palliative care is because I think learning how to help a patient and a family at that time when we can no longer save a life is an equally important part of our job.
Whether it's the partnership between Temple and Gift of Life, whether it's the team work that both organizations have together, the teamwork that it takes at our hospital at every level to really live and breathe organ donation.